ধরতে পারলে মনো বেড়ি দিতাম পাখির পায় খাঁচার ভিতর অচিন পাখি কেমনে আসে যায়. So Sundarban is the famous tourist spot and the world's largest delta, and yes, it looks very nice and attracts lots of tourists, especially because of the Royal Bengal tiger. But the situation of the local people is really very pathetic.
Many local families struggle with poverty, lack of resources like safe drinking water, and poor health care. This couple, aged 70 and 65, live in a vacant house which belongs to relatives, but otherwise they are completely on their own. Today a neighbor gave them fish heads and tails for lunch.
Elderly people somehow living there depending on the old age pension and the pity of the neighborhood and some other people.
Dipanwita Sarkar is a founder member and project coordinator of the non-governmental organization Dearah Association for Social and Humanitarian Action, Asha NGO for short. It is based in the Sundarbans delta in West Bengal, in the easternmost part of India. Most rivers in the region carry saline tidal water, and they flood almost every monsoon. As the area is also prone to cyclones, agriculture has been steadily decreasing. Fishing provides some form of income. Brick factories offer low-paid jobs but worsen the water problem. Young people move away for work, leaving the elderly behind. Surja Kantamondal and his wife Sita live in simple conditions in a small village. Their 4 children have moved away with their families. Today, Dipanwita Sarkar and 2 colleagues are visiting Surja Kantamondal for a health checkup. The 65-year-old is suffering from diabetes, high blood pressure and pain in hips and knees. Without the Asha clinic, we would die because of the lack of treatment. There would be no other option. We can't earn money and don't have any, so we aren't able to go to the doctor and get medication. Asha has established a project in collaboration with the NGO German doctors called Empowering Communities Towards Health Orientation. The project started in 2021 and takes an integrated approach to improving healthcare and raising health awareness in 49 villages in the Sundarbans Delta. At the core of the project is the mobile clinic. Asha staff travel to hard-to-reach areas and offer comprehensive basic medical care, including diagnostics and treatment. Following a set schedule, the mobile clinics are set up for half a day or a full day in each of the project villages once every 2 weeks. The mobile clinic is staffed by Indian and German doctors, nurses, health workers, translators and physiotherapists who provide both individual and group sessions, and the staff administer medication according to national guidelines and availability. While they wait, patients also receive education on a variety of topics.
There are government hospitals, but for those people, it is a hard nut to crack to access the hospital because of their age, because of the transportation, and finally, there is no one to accompany them to the hospital.
A key part of the project's holistic approach to long-term health care is building an effective community-based health worker system. The so-called community health volunteers, CHVs for short, play an important role in the mobile clinics as they are from the local area and know the people. The NGO German Doctors is involved in the medical concept of the project and sends volunteers for a 6-week period. The doctors consult with the patients with the support of interpreters and CHVs, mostly treating chronic diseases like hypertension or diabetes, as well as skin diseases.
And so the mobile clinic is valuable at this point to get the medical consultation and their stable ongoing treatment closer to their homes, so that chronic diseases can be treated properly and side effects or complications can be avoided.
The mobile clinics treat around 26,000 patients per year. A structured referral system to government health facilities has been established to ensure further treatment when needed. To reach remote communities, the clinic team travels on foot, by bike, by car and by boat. Twice a month, the team has to use multiple means of transport to reach one location.
And then we just pick up all our medical stuff, all our medication and things we need for the clinic, put it in our car, in our van, and then we drive to the next city, which takes a long time during the heat and all the traffic. Then we put all our things from the trunk to another vehicle, like a small cart maybe, and then we go through the town with the cart and all our stuff and our things. And then we have to unload the cart, wait for a boat, a small boat to cross the river, load everything on the boat, wait again for all people to show up and to enter the boat, and then do the same again on the other side of the river and unload the boat, load the tuk-tuk and take the tuk-tuk to the actual clinic.
The whole trip takes about 3.5 hours, one way. CHVs conduct home visits to provide follow-up care for clinic patients. This may include physiotherapy, monitoring blood pressure and blood sugar, providing wound care, and, if necessary, going with patients to state facilities. All of the project services are available for little money. Mahanta Sardar was partly paralyzed after suffering from a stroke. Only thanks to Asha's support is the 45-year-old able to move his arms and his legs again. The CHVs also deliver preventive health care by education. Today, a team is conducting a diabetes camp, giving talks and carrying out tests. Dipanwita Sarkar initially played a key role in shaping the concept of the project and led its implementation. Now she is focusing on monitoring and mentoring the staff. And the 41-year-old loves interacting with the people. The medical trainings of the CHVs are provided by Indian and German doctors. Today, Dr. Martina Bender is giving a talk on skin diseases. Gender discrimination is still a major problem in India, and Asha is committed to empowering girls and women. That is why, out of 156 CHVs, only one is a man, who has been there from the very beginning. Asha provides essential tools, transportation allowances and small monetary incentives for the CHVs. The women are highly valued within their communities. They are role models. 22-year-old Apita Das is responsible for the medication today. As a teenager, Apita was a member of a girls' group run by Asha. Within just a few days of starting work, the people in the community began approaching me about their health concerns, and I continue to support them in their treatment. What matters most to me is that when my parents see the community seeking my support, they feel very proud of me. Girls' groups and peer leaders are another key part of the project. With her educational focus on human rights, women's empowerment and child protection, Dipanwita Sarkar strives to give girls a strong voice.
We need to make them vocal, we need to make them expressive, maybe with some informal chats, maybe with some jokes, maybe with some singing, dancing, and we need to train them to be confident enough to say no in any kind of unwanted situation.
The project has created an effective link between medical care, educational work, raising awareness, and the active involvement of government structures. The project is headed by a team consisting of Asha staff and the Indian representative of German doctors. They are responsible for organizing the mobile clinics, coordinating the CHVs, and developing concepts. The heart of the project is made up of all the employees and volunteers who bring the services to the people with love, passion and humor. Nonetheless, it is fair to say that the face and the voice of the project is Dipanwita Sarkar.
কেমনে আসে যায়।